I'm Enrico Coiera, and in this talk, I'd like to focus in on the issue of AI evaluation. And specifically, how do we know that a clinical AI is performing well? Until recently, I think we had a strong answer for this question with the focus on classical predictive AI, focusing on classical evaluation methods based on statistics and so forth. Today, however, we are working with a new class of generative AI technologies. And as I discuss, they will bring with them their own new challenges. But I want to start by asking that we assume AI is here, that we can drop the future tense. So often in our talks, AI is something that is coming. Generative AI is here. It's now widely available and in routine use in clinical care. And we are witnessing a rapid and ongoing evolution of what generative AI can do and in the areas to which it is applied clinically. So the challenges and the opportunities of generative AI are here and now. If there was to be a poster child example of what I'm talking about, it is the medical scribe. This is the use of generative AI to summarize spoken conversations in clinical settings, whether it's a primary care clinician speaking to their patient or a ward round. And 3 to 4 years ago, you would argue that AI scribes were very much in the realm of research. Today, there are products proliferating across the world, really at a rate I can't keep up with. And the challenge we have really is that these technologies are in routine use, but certainly in Australia, regulation is not keeping up with the evolution of these technologies. And in fact, either they are outside of regulatory scope or they're treated as if they are more standard technologies, which they are not. So I'm very interested in the whole issue of regulation. And the model I use to think things through is very simple. We're just talking about the first, the middle, and the last mile. Last mile clearly is using a technology in the real world. First mile is more classic machine learning, capturing the data, cleaning it, making sure it's labeled and representative, and building our models, testing and trialing them happens in the middle mile. In terms of regulation, those first two steps, the first and middle mile, are what you might call pre-market steps. And post-market, in other words, once something's out in the real world, is where last mile occurs. In pre-market, classically what we do is we assess algorithms against benchmark tasks, up to and including randomized trials under very controlled conditions. And post-market has typically been lightweight, and it's surveillance of performance, for example, via incident reports, that sort of thing. The challenge we face is not just that regulation isn't touching things, but even if we do pre-market assessments, what's happening post-market is fairly unclear. And it becomes much more challenging when we think about AI and machine learning, which are what I would call dynamic technologies. Regulation historically assumes that once you get a technology or a device for clinical use, you can look at it once pre-market, look at the data from trials and tests, and you can certify it and know that that certification will now last as it moves out into the world, and then carry out, as I said, that very lightweight monitoring for unexpected consequences. The challenge we have when devices are machine learning enabled is that they're dynamic, that the algorithm might be updated like all software is, or it even might be adaptive locally, making certification once really insufficient given that behavior might be changing over time. The other big issue, which many of us are focusing on, is this notion of transportability, which is that the known performance of algorithms in one setting may not translate to performance in other settings because of variations in demographics of the population, of workflows, etc. So how would you regulate dynamic technologies? It's a good question and has been thought about very carefully by regulators. They have focused on, in the US, Canada, and UK, something called good machine learning practice. And the core of this is essentially to freeze the machine learning product, to have what's called a predetermined change control program. In other words, we certify something pre-market, and that is the technology that goes to market. And if there are to be changes, they happen in a controlled and planned way. The plan for that is lodged with the regulator, and there has to be really crisp and clear approaches to how we would assess the modified technologies prior to releasing them into the world. I also mentioned this issue of transportability, and from the perspective of transportability, this means that not just that the burden falls on a regulated pre-market, but then the folks that use the technology, the hospitals, the health services, the clinicians, now seem to have a duty to be competent in the use of either local adaptation or monitoring local performance of technologies. And typically that's captured not in regulation, but through professional accreditation. And there's a lovely paper in the NEJM from this year by Chris Longhurst, looking at the development of what he calls AI implementation science centers, whose job it is to adapt and evaluate technologies locally. And of course, all that's going to require robust local AI clinical governance. Now, that all sounds difficult. Generative AI makes it even harder. And that's because generative AI is different to classic deep learning predictive algorithms. When Gen AI produces an output, the output is not determined deterministically, it's probabilistic. We can give it the same input a few times and each time get a different output. Next, classically, a predictive algorithm is built for a specific task. Interpret a nodule on a chest X-ray, for example. Gen AIs behave as if they are general purpose technologies. They can be put to multiple tasks. So even though we might pre-market test a Gen AI on a specific task, it might be used for other tasks, and we can't predict what it will do with that new task, which is a non-benchmark task. Another really difficult challenge is that Gen AIs are typically massive scale. Large language models, for example, are opaque to reverse engineering. We don't really know how they're put together. And that's often driven commercially because model owners don't want to share too much about how things are put together because of commercial benefit. That makes it hard for us to predict from first principles what's going to happen if we put an AI into a different circumstance. Another challenge simply comes from scale. They are so big, these models, that it's very hard to fully describe them, even if you could inspect them. And it's very hard to infer behavior from structure given the huge complexity. It's what I like to call dark complexity. We just can't see what's in there because it's so large. To give you an idea of what I'm talking about in terms of scale, this is not a size graph. This is simply looking at the effort involved in compute to build a model over time. It ends about 2 years ago in 22. It's a logarithmic scale. So what we're looking at here really are exponential curves. And you can see up until the time of the arrival of deep learning, in that little blue bar, we had one exponential curve. It accelerated rapidly with deep learning, much bigger models. And then as we entered what's called the large scale era now, which is where we are, you can see a huge uptick again. And for those who are interested in some of the challenges in terms of commercialization of these technologies, all the blue circles are academic models and the triangles are commercial models. So you can see that commercial models are much bigger in scale than those that are being developed open source. So we have a real issue with the size of these models. It obviously is the reason they work, but it also makes it very hard for us to understand necessarily what they will do when we ask them to do something. So what can we do with generative AI? We could also try and freeze them, just as we did with predictive AI. We could say, let's limit you to a defined task only. um, minimize the prompts that we give to the AI. We freeze the foundation model, we don't update it. And there are parameters we can set the model, things with names like temperature, which increase or decrease the level of variation in output. So we can set those to minimize variation. That will have an impact, and in some settings that might be a useful thing to do. It does not make variation go away, nor does it reflect how people use these technologies. We basically want them to be generative. We want to use them on different tasks. We want to see them adapt. And so to take this approach would put a real limit on the way we can use Gen AI in clinical care, and it would probably limit the benefits we would see from Gen AI. So let me summarize the problems we have when we think about evaluation of these technologies. Number one, we cannot precisely predict how Gen AI will perform on a particular task. We can't predict how it might be used by a clinician. We have no guarantee that its performance on one task is reproducible or generalizable to other tasks. So the way I like to think about it is the evaluations of a generative AI are just a snapshot of a unique moment in a model's life on one small part of its addressable task space. That's all you get. So the pre-market regulation model, certify once, freezing, change control programs, these approaches are all less fit for purpose than they would have been for classical predictive AI. So one approach, and this is one I've been thinking about for a while, is to try and embrace this complexity and understand the properties of complexity and how that might give us new insights into evaluation. And what I'm proposing is that we may think of AI as an ecosystem, not a new idea in itself, but if we think it through, it brings us some interesting tools. Firstly, if AI is an ecosystem, and I believe it is, then we know that in other settings, actual bio ecosystems, these are also large and complex. They're not fully describable. Local behavior in terms of biology is emergent. It's not deterministic. And across a large ecosystem, behavior is not uniform. Seems very similar in a way to what we're talking about with generative AI. So can we move from seeing Gen AI as a thing to seeing generative AI as a dynamic, complex system? It's the same leap we take really with predicting climate versus weather. It's much easier to predict large-scale climate change than it is to predict what will happen outside your backyard tomorrow in terms of the weather. And so what might the components be of this Gen AI ecosystem? Well, it's a cyber-social system, right? Clearly, there are interacting bits of technology, the software itself, the transformer, the procedures we use to train and update it, the coexisting software that needs to sit around it for it to be used. There's a lot of fine-tuning, guardrails are put around it to prevent it doing things that we think we don't want to happen. And the training data it sees is part of its own ecosystem. Also, the way we actually use it, the prompts we might give it, our history of interaction with it over time, if there is memory for that interaction, and our behaviors once we have access to that information. And finally, as has been classically understood for a long time, the ecosystem also includes the place within which the technology is embedded, the organizational tasks, the workflows around it, the resources that are available. To give you an idea of what I might mean by ecosystem and measuring ecosystem, here are some potential measures that we might want to think about. The first one is a very simple idea, and it comes from ecological sciences, which is to think of ecologies as services, and that there are flows of services to the human world which supply us with things we need, and also flows from us back into the ecosystem, which might be our garbage, for example. And so we could think about this in terms of a stock of flows to and from the AI, in terms of inputs like the volume of training data, the distribution of the training data, and the number and outputs of volumes of say, documents produced by the AI, the number of questions you get asked, the types of questions you get asked. So you can just imagine this as kind of an overall view of the pulse of the system. How's it working? Is it all in balance? There are a set of other engineering tools which are available. So there's a notion of engineering resilience, which I think is probably going to be quite important. So resilience here is about the ability of the AI to resist disturbance and return to equilibrium. In our case, that means that the AI would continue to perform well despite seeing shifts, for example, in the distribution of tasks or the distribution of patients it sees, or indeed be responsive, not responsive to external shocks, for example, like malicious attacks. So this is a sense of the AI over time maintaining integrity despite what's happening around it in the real world. There is a related engineering notion called performability, and this talks about graceful degradation under stress. So, for example, what would happen if models became a little bit smaller? What happens if we train them less? Those things, might give us a sense of how resilient that technology might be and what sort of destruction and capability we might expect. These are all, in a sense, measures that might go on a dashboard to see how healthy the AI is. And there are other concepts like ecological resilience, which is more around how much change can the AI take before it rapidly changes what it does. And we certainly know with generative AI that phase transitions do occur. These are abrupt changes in the performance of the AI. Typically, they've been in the positive. So as we increase the available data for training, all of a sudden there's a phase transition in the capability of the model. But there are also negative shifts possible too. And without spending too much more time, there are a bunch of other measures which we think through. So the inertia or resistance to change. So, for example, if there are behaviors in the AI we don't want to see and we try and put guardrails around it, but it continues to persist in poor performance around these tasks, that might be inertia or resistance, an important metric in terms of whether or not we decide to use that AI. There's an obvious corollary with sustainability. How much effort is involved in building the thing? How much impact does it have on the environment? And then there are notions of diversity and variety in terms of the training. How much data has it seen? How diverse is the data? All of these things give us a sense of the overall ecosystem's suitability for its use in our world, and more importantly, its ongoing suitability. So having gone through that, I just want to go through a few what I might call case studies, which demonstrate how we think about things, and specifically, I think, provide some provocations in terms of problems we haven't yet solved at all. So let's see how we go. And the first one is focusing on AI scribes. As I said, these are now becoming ubiquitous really within the last 18 months. Really quite an amazing uptake of technology by the clinical world. And so in this first case, a GP, a general practitioner, is using their electronic record system. Gen AI comes for free with the product today, and they use it to generate a letter to a specialist using the generative AI. What happens? Well, we know today that generative AI can hallucinate. It can introduce confabulations. Remember, all it's doing is drawing answers from a distribution of potential answers, and it doesn't have a notion of truth, just likelihood. So it's possible that within the letter we've asked it to write, it might insert a diagnosis, it might omit a diagnosis, and it might do the same with medications. Clearly, right now, the burden is on the shoulders of the clinician to read those documents and to ensure that they are correct. But as these things become commonplace and create documents at volume, there is going to be automation bias introduced where people start to become highly reliant on the technologies and check less. How could we then monitor the performance of generative AI in this documentation process? Um, well, classically, you would do what natural language processing researchers do and have metrics looking for errors at the word, phrase, or document level. Uh, and those sort of things might be great pre-market assessments, but they don't reflect clinical outcomes at all. The other problem, of course, is that real clinical outcomes might be too far downstream from day-to-day use to be useful. So one other option is to think of what I call a technomarker that might do the job. And a technomarker, just like a biomarker, is a proxy measure which is somehow causally related to the thing that we're really interested in. It's an easy to measure thing. So we may not be able to measure accuracy of that letter in real time because that would require substantive effort. But we could look at the impact of the letter on the clinician himself. So, for example, if there is a requirement to edit that document to make it correct, and we start to see over time those edits increase, not decrease, that tells us perhaps that the technology is starting to degrade in performance. If we see edits very steady and then there's just a blip on a particular set of documents, that tells us something about performance on a document. Other examples of technomarkers, just to make it a bit more concrete for you, are classic ones that we think about anyway in informatics. So, for example, alert override rates are actually a technomarker for the quality of a decision support system. So let's look at the next case. And in this one, it's the use of an ultrasound to scan a thyroid in a workup for a nodule. AI is already used to interpret these images, usually deep learning in this case. And let's say a small nodule consistent with thyroid cancer is detected by our AI, who flags it to a human. What might the consequences of that be? The big issue for thyroid cancer really is overdiagnosis and overtreatment. So we already know that AI is better than humans at detecting thyroid cancers, either equivalent or superior to detecting these. But we already have this problem of overdiagnosis and overtreatment. South Korea has had a 15-fold increase in cancer, not because the cancer has increased, but just diagnosis rates have increased. The challenge, of course, is that most of these are very small lesions that never lead to harm. So in this case, improved diagnostic performance of AI causes unnecessary treatment, potentially patient risks of harm and economic cost. And the question I have from this case is, which technomarkers could we come up with which would alert us to these population level concerns like overtreatment? This is nothing to do with pre-market certification. It's got nothing to do with post-market monitoring of local performance. This is very much a population level impact of the technology. Right now, we don't think about this in the accreditations and regulation space. Case three is sort of the inverse of the last one. In this case, it's an AI-powered colonoscope. These are now purchasable. The AI will draw little boxes around the images it thinks contain potential lesions. And the feedback from gastroenterologists is that the false positive rates might be too high for this AI to be useful right now. So what I've heard anecdotally is that gastroenterologists will be turning off the AI and just using it unassisted because of the intrusion of the false positives. I think that would be a good case to say that that was a failure to use AI, which should have been used appropriately. And I say that because we know these AIs are going to be able to do things in partnership with gastroenterologists that they don't do so well themselves. Detection rates are about the same, but the lesions that are detected by the AI are typically the ones that are missed by the gastroenterologist. So smaller, flatter, isochromatic, hidden behind folds of the colon. These are the things that you might want to be detected early, and the AI will help you find, um, and will be hard for a human to detect, as I said. So, despite that false positive rate, there is a clinical benefit to use of the AI. And you could argue that use of that AI actually is standard of care, and failure to use it could be poor practice. So the question here really is, um, how do we find this out? This is not monitoring of AI use. This is monitoring of failure to use AI. An entirely different space. It's not the regulatory space. It's in the accreditation and clinical practice space. But it's got everything to do with evaluating the impact of the AI. And the last one I want to give you is drawn from triage technologies. In this case, the example is the use of AI to identify whether or not there is a potential stroke in the emergency department. The AI triage system looks at a CT, and what it does is highlight whether or not a patient should be prioritized. And when done well, these prioritized cases get seen earlier, they get treated earlier, and as we know, early treatment for stroke leads to significantly better outcomes. The challenge we have is that there is often a misunderstanding of what triage means, which is surprising. So clinicians think that if cases have been prioritized by this AI, then they would have stroke. And equally, those that are not prioritized don't have strokes. This is not the case at all. All the AI is doing is optimizing workflow. And the fact that a case is not being prioritized does not mean that a stroke is not present. So in the US, the FDA has issued a warning because people don't understand that they still need to look at those lower priority cases that are lower in the queue. They still may contain strokes that need to be treated. So in this case, the challenge has nothing to do with the AI, which is performing perfectly well, but with the systems around the AI, the people, the workflows, and other technologies. These are the places where we might see the problem occur. Remember, we think about this whole ecosystem. The AI might be part of something that leads to a problem, but itself not be the problem at all. So I will finish there. I've covered a lot of territory in a short time. I just want to close by saying, look, AI has moved from future tense to present tense very quickly. And in some cases, I would argue that innovation is moving so quickly that we really are not able to keep up with it in terms of thinking about evaluation, regulation, and accreditation. And if we're not moving as fast as innovation, we are falling behind. I think we start our process by simply asking, how do we know the AI is working? And I want to leave you with the notion that, at least with generative AI, we're going to need to get used to predicting the AI climate more accurately than the local weather. We may not be able to manage classical certainties in the way we would like with generative AI. It's a new world. Thank you very much.